Hi, good morning, everyone. And we'll quickly jump on to the topic here so that we don't have to waste time. Let me see how. So, let's talk about ongoing maintenance. Why is it really important to discuss ongoing maintenance? Because if one wants to grow in practice, then growth can happen only over a solid foundation, and hence the need to maintain or strengthen whatever is currently existing. What all do we have to maintain? Everything, right from the infrastructure which we have created, our equipment, manpower, as Dr. Debashish rightly pointed out, the goodwill which we have created amongst our patients, and of course, our focus of what we really want to achieve. Coming to the infrastructure, the physical structure or the ambience needs to be maintained. And essentially, we are looking at the first top three senses. That is, for the site, we need to maintain a clean ambience or an infrastructure. We prefer to have a good, bright, well lit atmosphere, and we can make it more pleasant by having paintings and maybe a television to keep the people occupied while they are sitting in the waiting room. However, I do not like the sound to be on. We keep the TV on mute and hence usually prefer to have silent movies like Charlie Chaplin running on the television. And we complement it with actually a soft instrumental music in the waiting room. For the smell, we prefer to have the automatic fragrance dispensers which are readily available now and without much intervention help create a good atmosphere. Also, what is important is that the maintenance of this infrastructure is an ongoing process, and hence there should be a team member or a manager who is responsible for maintaining this. And with responsibility, they should also have some power to go ahead and conduct minor repairs without having to disturb us or even take a permission from us. What we would need to do is just take frequent rounds of the facility with this team member to ensure that everything is in place as per the goals of the organization. And it is often a good option to have a civil contractor with which whom we have tied up, who is a regular person who takes care of all the civil aspects of the facility. And being eye doctors, it often helps to have some kind of civil contractors who are patients themselves or their family members and are ready to come and help us out immediately when at the just one single call, so that we can maintain our infrastructure to the level which is required by the patient. Regulatory compliance is also required to be maintained. This would depend upon the type of organization, but nursing home registration, fire NOC, and medical biomedical waste are something which is important, and NABH guideline often helps us to streamline this process. Again, financial compliance needs to be maintained, and again, depending upon the size of the organization, a lot of things will increase. A big size organization, besides taking care of income tax and TDS, will also require professional tax for all the staff, provident fund, and GST if we are going into the optical business, optical services like spectacles or the pharmacy. When we are talking about maintenance of the equipment, we need to ensure that our medical and non-medical equipments are fully functional. Again, we need to train the manpower on instrument handling so that each and every instrument has a longer life and are well maintained. And looking at the overall financial project, one will have to think about going for CMC or AMC for all the medical equipment, looking at insurance policy for all the equipments, and having a regular preventive maintenance system so that the downtime of the equipments is reduced. Because remember, a non-functioning equipment provides a false sense of security and are actually a liability, and we will end up trying to save face from the patients when we actually need that equipment the most. Manpower maintenance. is the most important pillar because the manpower is what projects the organization to the patients. It takes a lot of effort to create teams, and equal amount should be taken to ensure that the team is not broken. Regular interaction with the team members at all levels and training on the go are important aspects which help improve the performance of the team members and also ensures employee satisfaction. Remember that aligning the staff with the long term goal of the organization helps retain the priceless ones. How do we maintain the goodwill of the organization? Remember that in healthcare, word of mouth publicity is the best publicity, and a goodwill may be difficult to earn but very easy to lose, especially in this era of online reviews in form of Google review and Practo review. And hence, one should ensure that the whole team is aligned to providing service to the most important person, that is the patient. Never lose focus in all this about what we and our organization stand for, and often discuss this with all the team members. So if the focus is to provide great service to the patients, let this be discussed and talked about amongst all the team members. Coming to the second aspect of consumables, a detailed knowledge of consumables is important to align the consumables with our goals, to align them with the patient needs, to plan various surgical packages, to plan which medical equipment needs to be purchased. And with respect to consumables, we need to set up again teams which help with the procurement of the consumables. Now, first and foremost, with respect to consumables, we need to evaluate which consumable regarding all the consumables, whether the cost justifies the scientific and service goals of the organization. Yes, definitely. As a doctor, using various consumable helps in improving our clinical experience and the joy of working. But we also need to remember the patient's point of view. Patients often read up about various options, like various different intraocular lenses or surgical techniques, which are often marketed. And patients should have the option of choosing what they want and pay the relevant charges. Having multiple options in terms of consumable helps to convert these patients into patients who would undergo the surgery if we can offer them what they really want. And also in this way, organization spends only on what the patient is ready for. For doing this, we need to create various packages. Patient gets the option to choose whichever package they want based on what is there in those packages. And because the patient is paying by choosing what package they want, the organization spends for consumables based on what the patient decides and pays for. Also, the consumables are linked to the equipment purchase as a whole because consumables play an important role in overall profitability and the break even calculation. So, careful planning and calculation should be done based on the workload, a demand for a particular machine. And remember that higher the volume, more is the burden of the non-reusable consumables. And hence, we often see that in charitable hospitals, they often buy machines which have reusable cassettes. So, all this needs to be kept in mind. Also, for day to day consumables like cassettes, intraocular lenses, and other systems, we need to set up teams and set up automatic procurement, whereby as soon as there is a case which requires a given consumable, it is ordered. Or let's say for a retina setup, if the stock of silicon oil goes below a certain level, then it is automatically reordered. And this can be done by manually scrutinizing a stock register regularly or having a inventory software which can do this automatically. Coming to the last topic of controlling the outgoings. Do we really need to control the outgoings? Remember, when thinking about outgoings is that outgoings are an integral part of growth. As we talked about the consumables, when the proper planning of packages is done to align the cost of consumables to what the patient is paying, we really need not bother about this, because whatever consumable is going as an outgoing expense, correspondingly the patient is paying for that. But overall outgoings such as rent, EMI on equipment, marketing expenses are necessary, and one needs a proper planning with respect to this. Because remember, letting the things flow, being positive, allows more things to come. So, to summarize, maintenance of all the aspects is important for the growth of the organization. Consumables, if we provide what the patient wants and has paid for while looking at the long term goals of the organization, it does not remain a stress factor. And for regarding outgoings, we should reduce wastage definitely, but do not try to control outgoings, because calculated more the outgoings, more will be the incomings. Thank you very much.